Is your shoulder painful and do you have difficulty in raising your shoulder and arms? That can be a symptom of frozen shoulder, and usually it worsens over time. It becomes more painful and it can actually last up until 3 years. Some patients, they cry because of the pain. Well, don't worry, because in this video, I will share with you the 3 things that you need to do every morning. Stay with me until the end, because I will also share with you the 3 common myths about frozen shoulder management, plus bonus tip, how to properly use both hot and cold compress to help ease the pain naturally and fast. If your shoulder joint is painful, if you find it difficult to sleep on your affected side, if you find it difficult to wear your jacket, your blouse and shirt, that can be a symptom of frozen shoulder. Do you know that simple x-ray of the affected shoulder, that is very good because it can already confirm the diagnosis. At the same time, we are able to rule out other conditions affecting the shoulder joint, such as osteoarthritis of your shoulder. Clinical examination is also very important because we will evaluate your limitation of motion. With frozen shoulder diagnosis, usually 3 limitations of motion are encountered by patients. Please check if you can relate to this. Do you have difficulty raising your shoulder and arms to the side? This is actually shoulder abduction, and this is limited for those diagnosed with frozen shoulder. Do you find it difficult to put on your shirt or jacket? That is actually shoulder external rotation, and that is actually limited for those diagnosed with adhesivecapsulitis. And try to check if you can relate to this. Is there pain or limitation of motion every time you reach your back, such as when you lock your bra or when you reach for your back pockets? That is shoulder internal rotation, and that is actually linked with frozen shoulder. Now tell me, please comment down below, which of these movements do you find it hard to do or do you find painful? I would really like to know. Do you know that if you experience these 3 limitations of motion and you notice that it have worsened over time, then frozen shoulder diagnosis is really likely. Now at home, this is what you will do every morning. As soon as you wake up, I want you to stand beside a wall. Now using your affected side, you let your fingers walk through your wall and try to check at which position or range are you most comfortable with. You try to maintain that position for 7 seconds. Put your fingers down and then you repeat that one 10 times. This is a very simple exercise, but this has been clinically proven that this can help with shoulder mobility for as much as 4 weeks if you do this consistently. Next is pendulum swings. With pendulum swings, you are just going to stand using your other foot and your other knee. You try to bend slightly forward. Then you just let your affected shoulder hang. You move it from front to back 10 times. You move it side to side 10 times, and then you move it clockwise 10 times and counterclockwise 10 times as well. You do this consistently. Pendulum swing is a mainstay treatment for frozen shoulder or adhesive capsulitis management. Do you know why? It is very simple. However, it is effective because in this exercise, we are letting gravity help pull and help provide space for your shoulder joint to allow more mobility and to help you with the pain. Next is towel stretch. You get a towel, you hold it at both ends, and then try to pull it up as far as you can go. You try to maintain this position for 7 seconds, put it down, and then you repeat it 10 times, increasing your range every time. This is a very simple yet effective exercise. It will target shoulder internal rotation. If you have difficulty reaching your back, this is a very effective exercise for you. Now, here are the 3 myths for as much as frozen shoulder management is concerned. Don't move your affected shoulder because it will get worse. That is actually wrong because you know what? You need gentle, guarded, and consistent movement. The more you immobilize your affected shoulder joint because of the pain, the stiffer and the more painful it will get. Myth number 2, pain relievers are already enough. That is wrong. Pain relievers can give you temporary relief from your pain, but it will not directly solve the problem. You need the proper exercise to help you recover from adhesive capsulitis or frozen shoulder diagnosis. Myth number 3, frozen shoulder is self-limiting. That is partially true because you know what? It is self-limiting. However, you need to know it can last up until 2 to 3 years and it can severely impact your quality of life. The sooner you will get treatment, the sooner you will have the right exercises, the faster you will recover. And mind you, for patients who are fully recovered, some of them who did not do their exercises, there is still limitation of motion. They cannot fully abduct, fully externally rotate, and fully internally rotate their affected shoulder joint. These are the 3 best tips that you can do at home. Plus, bonus point, how can you properly use both hot and cold compress to help you with frozen shoulder management? Here is the key. We use hot compress for 20 minutes on your affected shoulder before you do the exercises that I have shown you. Usually, I recommend a hot compress like this to my patients. The purpose of this, it is lightweight and it can contour well to your shoulder joint. It also has a timer which you can already set for 20 minutes. The purpose of hot compress, which is very important for adhesive capsulitis management, it improves blood circulation in your affected joint. It helps with the pain naturally. At the same time, it will help with your range of motion. Now, after you do your exercise, it is recommended that you actually do cold compress for 15 minutes. You wrap any cold compress that you have at home with a cloth, then you put it on your affected shoulder. The purpose of hot compress is we prevent delayed onset muscle soreness, or otherwise known as DOMS. This is a normal physiologic response of the muscle, especially if you haven't been doing exercises of your shoulder joint because of the pain. This is the important things that you need to do for as much as frozen shoulder management is concerned. These are the same tips that we teach patients in the clinic. If you find this video helpful in exchange of the time that I have put in to share this valuable information with you, please don't forget to click the like button below and don't forget to subscribe for more helpful videos in our channel. If you want to differentiate if the cause of shoulder pain is due to problem in the heart, we have a video here. Check on it. It will greatly help you. Thank you very much for watching. I will see you on our next video.